Hello, my name is Brenda Suggett, and I'm the Executive Director of the Canadian Association of Road Safety Professionals, or CARSP. And I'm here to welcome you to today's webinar, which is entitled Building Capacity for Sustainable Transportation. And I have two speakers here that I will introduce in just a minute. But first of all, I want to officially welcome you on behalf of our two associations. This is actually a joint conference from both CARSP and ITE Canada, and it's actually a component of a larger partnership agreement that we have with ITE Canada. And just a little bit more about that partnership agreement. So it started back in June of this year, and it actually goes for a period of 2.5 years till the end of December of 2025. And there's an actual physical document that outlines the areas that we are partnering on. So I encourage you to look at that. It's on both of our websites. But just to give you an idea of the spirit behind it, we saw that there was a lot of interest, growing interest in the whole area of transportation safety issues. And we saw that there was this opportunity for our two associations to work more closely together. And really at the core of this is trying to make sure that each of our memberships has to maximize the quality, value, and the breadth of information that we can give them. And one of the things that we are offering as part of this partnership agreement is these webinars. And this is actually our second webinar that we have offered. So I welcome you and thank you so much for choosing to participate today. Now, before I introduce you to today's webinar facilitators, I'd first of all like to go over some housekeeping items. So first of all, we do take questions throughout the whole hour, but we reserve question answering until the last 15 or so minutes. And we ask that you submit them through the Q&A function, which is at the bottom of your screen. Secondly, there is a post-webinar survey, and it will pop up automatically as you leave the webinar. And I just want to say how important it is for you to fill that out. It really does assist us. And today's webinar survey will actually give us ideas for future joint webinars. It'll also give you an opportunity to give us feedback on today's speakers as well. So I encourage you to do that at the end of the webinar. So without further ado, I will now introduce our two speakers. So the first speaker is Dr. Marie-Soleil-Cloutier. She is a professor at the Institut National de la Recherche Scientifique, where she is a scientific director of the Pedestrian and Urban Space Laboratory, or LAPS. Her expertise in health geography and urban studies is used through research interests on walkability and road risk for the most vulnerable pedestrians in urban areas and for all road users across various territories. She collaborates with various actors in the public and private sector, as well as with researchers in Quebec, Canada, and France. And our second presenter is Dr. Emily McCullough. She is a postdoc fellow at York University in the Faculty of Health Science. She works under the direction of Dr. Alison McPherson, who's also with York University, and Dr. Sarah Richmond, who's out of Public Health Ontario. Her doctoral work was conducted in the fields of sociology and philosophical ethics and examined care and caring within coach-athlete relationships in youth competitive sport. However, her research scope has expanded to include road safety, injury prevention, and the built environment. Upon completing her PhD, she joined a pan-Canadian research team dedicated to reducing road-related injuries and deaths, as well as promoting active transportation. Her ongoing work focuses on accessibility, equity, and the built environment, as well as system-based approaches to safe and sustainable mobility in Canada. And thank you so much for joining us, and you have the floor. Thank you so much.
Thank you, Brenda. Good morning, everyone. It's a pleasure for us, me and Emily, to be with you today to talk to you about this amazing projects that started almost a year ago now, and that is the name is the CapaCITY project, building capacity for sustainable transportation. I'm really proud of this little logo we just created for the team. So it's my pleasure to start this conversation today with you with an overview of the whole project, and then Emily is going to talk to you a bit more about the objective 3, and I'll let her tell you what it's about in a few minutes. Next slide, please. So the capacity team, as we call it, is a team that is funded by CIHR and NHMRC, which is the Australian grant body, under an implementation science team grant. So it was really focused on implementation science. We'll tell you a bit more about what it is later. So basically, our goal is to catalyze successful implementation of sustainable transportation intervention in cities. And we say successful here, but to be honest, we also want to look at failed one, just to make sure that we understand the whole process and how we can actually do better in the future. This is one of the goal of the capacity team. What's implementation research? It's basically to understand the conditions that lead to successful implementation of these interventions, including understanding who are the actors, what are they doing, why it went well, why it didn't, etc. We are over 50 researchers and partners in Canada and Australia. As I said, the funding is coming mostly from CIHR, and the whole idea of this team was really to have a wide array of different cities, but also projects and interventions. I'm going to talk about that in a minute. Next slide, please. So our broad vision is to accelerate a dramatic increase in the number of diversity of people using sustainable transportation in Canada and Australia. It's pretty bold, probably, that's what you might say, but the idea here is that like within the context of the climate change crisis we're having right now, and even the health crisis that goes with it, having more people choosing sustainable transportation, or be happy about it, because sometimes you do have to walk or bike or take transit, but it's not your first choice. You would love the car more. The idea is to shift all this, and because we think it's how the future of Canada and Australia is going to be better. Next slide, please. So in order to achieve this vision, what we want to do within this 6-year project, at least, and it's a long run anyway, so we hope that we're going to continue to work on this after even. The idea is to understand the key implementation factors, as I was saying earlier, for the scaling up and scaling out of those interventions across different municipality contexts, but also across different population. You saw it in the vision earlier. Basically, we know that there's people for whom it's harder to bike, to walk, or it's not as they don't see it as safe, for instance, or their neighborhood is different. So the idea to have a look at those specific population is also at the core of the capacity team. Next slide. So where is it happening? And I was just saying that it's scale in and scale out. Basically, with the budget that we were given anyway, we couldn't do all of them Canadian cities, obviously. So we chose 9 of them. And I don't know if there's anybody on the line who was part of capacity, but I really want to acknowledge all those partner cities that are already giving us data sets, are collaborating to us, answering our questions, agreeing to do interviews with us. It's really amazing. This project wouldn't be able to move forward without those cities. Or state, because in Australia it's the Victoria state that we have overall, just because of the governance of the implementation interventions, basically, of the intervention, sorry. So we have Halifax out east, Montreal, Kingston, Toronto, and Guelph, Saskatoon, Calgary, Surrey, and Victoria. So as you might know already, those cities are different in size. The projects we found in them are also different in size. And I would even say that sometimes the political will or the political context to put the interventions that we chose is different also within each of those cities. So this is quite interesting for us actually to have a look at different case scenarios, let's say. Next slide, please. So basically, we want to look at two types of interventions, and one is directly related to the CARSP, and well, all of this is related to ITE, I would say, but for CARSP, the speed management interventions are the one that are having the most potential effect on road safety, but even the AAA bike network also, to be honest, because it's better infrastructure for cyclists, so then they would be less in danger of crashes with cars, for instance. I'm gonna get back to this in a minute, but basically the whole team got 4 objectives. The first one is to document the implementation, so phase objective 1, and we even added actually an objective 0 before the document, which was only the mapping of the interventions that the city sent us, and this is almost done actually. Then we want to examine equity, health, and mobility impacts of those interventions and of the implementation process that led to them. Objective 3, advanced implementation science. Emily is going to talk to you a bit more about that part soon. And then the objective 4, which we won't really cover today because it's in a few years that we will actually get into this, but we want to develop tool to scale up and scale out all the results of the 3 first objectives, just to make sure that other cities, and we will test it with other cities outside of our 9+1, I call it, the Australian one, and they might try it also outside of Victoria here in Australia. This tool is really the idea of we want our research results to be used by people in the field after. We also have, in addition to this objective, 3 hubs, we call them, kind of working group, but really important one that are actually our advisory group throughout all those objectives. We have an equity group, a training one, and a knowledge mobilization one, which have different goals for each of them, but those are 3 really important questions that we wanted to address as a team also. So that's why we put extra hubs for them. Next slide, please. So the first type of intervention we will look at, we are already actually, is the all age and ability bike infrastructure. So it's AAA, we call it. Basically, as you all know probably, there's a whole bunch of types of bike infrastructures out there, but they're not as safe, all of them, or as comfortable for all age and ability. That's why it's called this way. And for those of you who might be French speaking, we don't have a good translation so far that is doing the AAA thing. All those tous âges, toute capacité, it doesn't work in English as well, I would say. But anyway, so here there's 4 of them that are considered all age and abilities. The cycle track, obviously, which is not on the road, the bike only path, the local street bikeways, which we do have a bit more out west, to be honest, and the multi-use paths that are paved, not gravel. Those are categories that were coming from past research from Megan Winters and other of her colleagues from that did that several times. To be honest, for the few past years, I can't remember when that started, but she had projects to define the type of bike infrastructure and then look at how safe they are and comfortable they are for people. So we did work with this past work. We haven't reinvented much for this, and then we're going to apply it to all the bike network in all those 9 cities to see like the proportion of the network they have that it can be considered AAA based on our definition. You see here that I use the word network a little bit in my sentences, but we don't agree so far, and we're going to do another workshop. Thank you for the Canbic. Yeah, exactly. That's exactly the project I was talking about. We will do another workshop with the cities after Christmas because we're not sure how how to define being in a network. Right now, we want to know what the infrastructure but for instance, if you have like 1 kilometer of AAA, but then you have to go to another type of network and then to another type of infrastructure and then another type, like there's no real network in this. Like, how are you supposed to manage that as a cyclist, for instance? So the network question is a bit more tricky than we thought, but for now, we are taking those interventions as the one we want to look at, and we're going to look at it's there, and it's also in the really right network. Next slide, please. So as for the speed management intervention, we wanted to be more precise in what we wanted to evaluate, but also being able to make a little bit of sense of some of those. And I'll tell you in a minute what I mean, because basically we wanted to have interventions where the main intent was to reduce speed, according to road type also, because the golden standard for speed reduction in cities especially is the 30 kilometer an hour. It's the WHO that told us that a few years back, and we all know it's working. However, after discussing with some of those cities, they were saying, yeah, well, you know, I got arterial roads that were at 70 that I reduced to 50, and that's a gain, you know, that's a road safety gain. So we are targeting 30 kilometer an hour on local roads for sure. But then this is why we said according to road type, because we want to have a look at other road types than the local one and see what the cities are doing on them. Probably reducing speed, but not as much as low as 30 kilometer an hour. We also have a lot of 40 kilometers an hour in Canada. So we want to look at this. Obviously, if your main intent is to reduce speed, you have to do it through some specific type of intervention. So we targeted 3 here. The built-in road environment change, mostly traffic calming, in short. Enforcement initiatives, which are the speed cameras, which are everywhere in all those cities. There's at least a few of them. Sometimes it's 2 cameras that are going around, but still. And Australia is quite strong on speed cameras for a little while now, so we're gonna also work with them on this. And then regulation, usually it's a new, I was about to say trend, but I'm not sure I like this word, of a zone, 30 kilometer zones, 40 kilometer zones, where you don't put signs everywhere, but it's just you're entering a zone, you're supposed to go at 30 within this zone. I know Calgary just did it, Montreal did the 41 a few years back, and it's spreading out in a lot of cities. Victoria is doing a few of them. So we're looking not all the time at big zones, but still in a lot of our cities, something's happening in terms of regulation. However, as I was saying earlier, if you take traffic calming, for instance, sometimes it's really, I was about to say almost random spatially, like citizens get together and they ask for a speed bump and they ended up having it. But those are like really one-on-one type of interventions. So, and not that it's not interesting, but we wanted to have a look at the real impact of some coordinated program. So that's why we added this second condition to be an intervention within the CapaCITY team. So basic with dedicated funding also, you know. So for instance, in Montreal, they have a program where they make the schools safer, let's say. So sometimes it's a combination of built environment and enforcement and regulation within those zones, but this is an official program with dedicated funding, and this is the kind of interventions we want to look at. Sometimes it's a bit simpler than that, but still those are the interventions that we're mapping right now for the speed management interventions. Next slide, please. Okay, I'm gonna go quickly on this one because it's a big one, but you can always reach out if you want to have a look at it. Basically, this is our project plan. So we're gonna look at the implementation process first within the objective 1, and then the outcomes, including the implementation outcomes, but also, as we were saying, the neighborhood outcome, including collisions, but also some counts. And also we want to look at the satisfaction, perception, and then scale up and scale out the implementation framework for sustainable transport. The one before the last one is what Emily is going to talk in a minute, and then the capacity building is the objective 4.1. Next slide, please. So here you have objective 1. This is the one that we're almost done, I would say. So we did interviews. We map also the interventions that were given by cities. We are just about to finish our case study selection within each of those cities for interviews. Obviously, we map all of the interventions, but we won't be able to interview everybody for all interventions. It's too many. There's too many things happening, which is great news, I guess. A document analysis also is starting, and we'll do some interviews in the spring of 2024. Next slide. The objective 2, the examine, again, this one is really on the outcomes that we will need to gather. So the social spatial analysis is going to be on segmentary data sets, counts, speed, collisions that we already have in cities. However, we're going to also do a community survey, at least in 3 cities. We want to do more, but it's going to be a matter of money at this point. And then we'll do also focus group, probably in the same cities as the survey, but maybe not. So the idea is really to examine the impact of those interventions on health and mobility outcomes, as I just said. Next slide, please. So just to finish this part of like the quick overview of the whole project, our challenge here, and really what was interesting in our discussions with the CIHR, which is the Canadian Institute of Health Research, is that usually implementation science is mostly targeting individual behavior, and how you can change those behavior, like doing more physical activity. Here, we want to look at implementation science under the lens of the built environment space, meaning that cities are doing interventions, and this is what's going to change the behavior. It's not the whole, well, the person is going to choose to change their behavior probably, but there's something different happening here in terms of implementation science. This is quite innovative, and this is quite interesting, obviously, to us. That's why we decided to do this project. But still, outside of the health sector like that, this is something a bit more challenging also. And I think Emily might talk a bit about it because she's in it already. But that's the whole idea of objective 3, is to actually adapt the theoretical framework that exists for the built environment space. So thank you for that, and it's all yours, Emily.
Wonderful. Thank you so much, Dr. Cloutier. That was a really great overview of the work, and I'm going to dive a bit more into objective 3 here, which involves developing a novel skeleton framework for sustainable transportation interventions. So for the remainder of the presentation, this is a look at where we're going. Before diving into the framework itself and where we're at with its development, I'm going to provide an overview of implementation science and implementation science frameworks, such as the Consolidated Framework for Implementation Research, or CFIR. I will identify a significant gap in this body of knowledge that informs CapaCITY before discussing the latest draft of our skeleton framework and how it was developed. So implementation science, as Dr. Cloutier described, originated in the healthcare space at a time when successful research and clinical innovation did not guarantee its uptake or use in practice. However, implementation of evidence-based practices and the study of best practices for implementation are foundational to public health outcomes broadly. So implementation science extends beyond measuring and evaluating the effectiveness of the intervention itself to include an examination of the barriers and facilitators to the successful implementation of the intervention. The scope of implementation science also includes moving beyond examining individual care practices by accounting for the context in which the intervention is implemented, including the provider of the intervention, the organization, systems, and policies. Thus, at its core, implementation science is focused on understanding how interventions and policies come about, how they can be translated to new contexts or scales, and who benefits. Implementation science and practice are informed by a robust literature and myriad of models and frameworks, which offer efficient ways of generalizing findings across diverse settings. Embedded in many of these frameworks are the social determinants of health, the characteristics of the individuals who will deliver the evidence-based practices, and characteristics of the intended recipients of the intervention. So overall, implementation science frameworks and theories guide the selection of implementation strategies, and inform all phases of research by helping frame study questions and develop hypotheses. Such frameworks also clarify constructs to be measured, illustrate relationships that need to be examined, and contextualize results. So an example of a widely used implementation science framework is the Consolidated Framework for Implementation Research, the CFIR, which is a practical guide for systematically assessing potential barriers and facilitators in preparation for implementing an innovation or intervention. The CFIR provides a menu of constructs arranged across 5 domains that can be used in a range of applications. The CFIR has been used to guide research in many contexts, such as healthcare, public health, education, agriculture, and road safety, to name a few. However, it is important to note that the CFIR referenced on the previous slide is the second iteration of this framework. In 2009, Dan Schroeder and colleagues developed the first CFIR, which was updated in 2022 after eliciting feedback from experienced CFIR users. Some important changes included the shift in language from intervention to innovation and from patient-centered to person-centered. These changes reflect the need to expand the scope of the CFIR in order to increase its utility across a diversity of settings. Further, the updated CFIR more explicitly includes equity as an important consideration for implementation research and science and design. According to Dan Schroeder and colleagues, we must seek opportunities to subvert established systems of oppression by including and sharing power with members of historically excluded groups in implementation and evaluation. Therefore, other important changes to the CFIR include subcontracts such as human equality-centeredness, recipient-centeredness, deliverer-centeredness, and learning-centeredness. These are housed within the culture construct under the inner setting domain. So what does all this have to do with CapaCITY? One of the motivations for the CapaCITY project, broadly, is the absence of implementation science frameworks designed for sustainable transportation interventions. Existing frameworks tend to operate at the individual and organizational levels, which oversimplifies factors that operate at community, policy, or societal levels. Sustainable transportation interventions are complex, involving multiple actors, and the social, political, economic, and environmental contexts span local, provincial, and federal organizations. In addition, CapaCITY team members have heard consistently from city partners that there is an unmet need for support in how to best implement sustainable transportation interventions in their local contexts. Thus, applying and advancing implementation science in the realm of healthy cities offers an opportunity to understand how and why sustainable transportation interventions are successful for promoting health and mobility, and for whom. Therefore, Objective 3 of the CapaCITY project is to develop a novel implementation science framework for implementing sustainable transportation interventions, which we are calling the skeleton framework. So for the remainder of the presentation, I will provide an overview of the steps taken thus far to craft this framework and where we're at with its development. So far, there have been 2 major contributions to the skeleton framework draft. First, there are high-level results from a scoping review, which searched for frameworks from the fields of implementation science, sustainability science, political science, and other disciplines that have application for large-scale interventions, such as sustainable transportation interventions. 21 articles were extracted during this process, and the manuscript is in its editing stages. Second, we engaged in a brainstorming session with our Australian research colleagues about the design of the skeleton framework using results from the scoping review to facilitate discussion. We reviewed all of the constructs and themes identified across the scoping review articles and developed a list of 17 constructs to guide our first consultation phase with the Australian team. These include appropriateness, theoretical perspectives and evidence, in quotations institution, roles and responsibilities, provide diverse representation, early and continuous involvement of partners, acceptability, collaboration, networks, adoption, legitimization, adaptation, sustainability, environmental sustainability, transparency, livable streets and neighborhoods, protection of the environment, and maintenance. As this was meant to be a starting point to guide discussion, constructs were chosen according to their alignment with sustainable transportation interventions. In addition, we identified 7 equity-focused constructs that could inform the skeleton framework development, and they include social equity, social inclusion, help to disadvantaged groups, accessibility, wayfinding, health, and mobility of vulnerable groups. As previously noted, implementation science frameworks ought to prioritize equity by including the voices of excluded and marginalized groups throughout the process. We also noted that several frameworks included time points, such as pre-implementation, implementation, post-implementation, which we included with our presentation of the scoping review constructs. Myself and principal investigator for Objective 3, Dr. Alison McPherson, traveled to Australia in September to meet with research team members at Monash University in Melbourne. We presented the constructs and time points to the research team as a starting point for discussing how to craft the skeleton framework. However, the discussion was not guided by the constructs we presented. Instead, Australian research team members were wary of situating constructs according to time points in the implementation science process, and instead guided our conversation towards discussing the complexity of interventions. In particular, research team members discussed sustainable transitions, literatures, and models, suggesting that we draw some inspiration from how this body of knowledge captures cultural, institutional, and political complexities. So this iterative process helped us to develop the first draft of the skeleton framework, which attends to the complexity of sustainable transportation interventions by identifying general constructs or principles that operate, albeit differently, at each point during the implementation process. For example, the political context at the pre-development phase may include a lack of political will or resistance from politicians to implementing the intervention, while at the takeoff and acceleration phases, the political context may include political champions who are dedicated to successful implementation. Further, these general constructs or principles also influence each other. For example, community consultation and equity are closely tied, with mechanisms for equitable community input differing depending on the phase of implementation and the setting. Therefore, this draft is the result of an iterative process, including the scoping review results, a brainstorming session with our Australian colleagues, and learnings from the sustainable transitions literature, which offers a way of capturing the complexity of interventions, and is also why we changed the time point categories to pre-development, takeoff, acceleration, and stabilization phases, as you can see here. I would also like to credit our team member, Aman Chandi, for crafting the digital representation of the skeleton framework draft. So what's next? As Dr. Cloutier explained, the goal of Objective 1 is to document the implementation process and outcomes of sustainable transportation initiatives. Research team members assigned to Objective 1 have already conducted preliminary interviews with key informants about the implementation processes in their cities broadly. Once reviewed, these data will inform the development of the skeleton framework. Objective 1 also includes document analysis, the results of which will inform the skeleton framework. Next, Objective 1 will be conducting case study interviews about the implementation processes with key informants in different cities. These data will provide insights that will contribute to the development of the skeleton framework. Lastly, we will be conducting brainstorming sessions with Canadian research team members to gather feedback on the existing draft of the skeleton framework. Overall, this work will advance the CapaCITY project by considering the complexity of multi-level and intersectoral systems within which sustainable transportation interventions are implemented and scaled, and the equity-focused lens through which they must be understood. On behalf of Dr. Cloutier and myself and the CapaCITY team broadly, thank you for attending our webinar today, and we look forward to answering any of your questions.
Thank you to both of you. Excellent presentation, and I'd be lying if I said I understood everything. It is very complex, and but obviously a lot of thought has gone into it, and it's interesting when you met with the Australian team, how your focus shifted and changed, and I guess, you know, it's one of the benefits of reaching out to the others. I know Australia has a long history of doing a lot of things in road safety and are definitely leaders, so it's great they were able to get that feedback and work with them. So we're now at the question and answer period of the webinar, and so we do have a couple of questions, and I might as well start right off here. So what are effective ways to prevent cyclist pedestrian conflicts on multi-use paths? So I'll leave that open to either of you. Okay.
Yeah, I don't think I'm having any answers to that, but I can say we will try, because as you saw in those interventions that we decided, those multi-use paths do not have cars, obviously, but they do have pedestrians and cyclists. A few things were actually tried by cities, just by paint on the floor, I mean on the road or the path, I should say, but also with other types of separation without being a separation per se, you know. So we might look at those differences in the intervention to have a look at if it makes a difference, but it's a bit outside of the scope of CapaCITY, but we want to also look at rationale behind the construction of those multi-use paths, and was any idea of those conflicts between pedestrians and cyclists part of the decision-making process. This is what we're interested in here, more than this, well, it's kind of the safety, but like in reverse, basically. And this is what is interesting with the CapaCITY team, is that we want to ask questions. We want the cities to ask these questions before building anything. And so far, I know many cities or many projects are like that, but others are not. So this is why also we are interested in this whole implementation process. So I'm not like, I don't have a real answer for you, because we're not there yet, but for sure, this is something we're interested in.
Okay, great, thank you. And we have another question here. Can red light cameras contribute to vehicle speed management? Many cars speed up to run through red lights and can endanger pedestrians, especially where there is an advanced pedestrian crossing. Have personally seen near misses with pedestrians. So red light cameras, are they going to be part of it?
I'm not sure they have any effect on speed that I've seen of, but we didn't include them. We only included speed cameras because of the direct effects that we know in the literature. I haven't seen, from what I recall, there's an effect of the red light cameras on crashes probably, but on speed, I haven't seen any. From what I recall, but this is this is why, like, for sure, we wanted to focus on the speed cameras because we want speed management intervention. And as I was saying, there's like plenty of things that change speed, like even lane reduction, for instance, you know, a whole bunch of things like that. But we wanted to have them that are aiming at. So the red light ones are not aiming at lowering speed usually. They're just at, well, it's part of the bundle, right? But it's not a direct effect. So that's why we didn't use them.
Okay, thank you very much. We have another question here. It's how do you propose to scale out? There may be considerations that only apply to large, small municipalities. How will you be able to distinguish what is common and what is not?
This is the whole purpose, honestly. So and that's why, like, you see, we have, like, let's say mid-sized cities in our sample of 9 cities, because there's not, like, maybe the smallest is, I don't know, Saskatoon, Guelph, probably, I guess. But we want, after we will have all the results from objective 1 and 2 and moving towards objective 3 is already there, but in terms of framework, maybe the framework is going to be a bit different between small and big cities. Maybe, Emily, you can react on that after. But for sure, for objective 4 and scaling out through a tool, for instance, the size of the city will have to be one of the contextual elements that you would put within the tool to make sure how you can make better decisions in terms of interventions and what should be your not should be, but what would be the best implementation process. So we're not sure of anything yet, but this is the goal for sure, to make sure that this would be scaling. We will be able to scale out to different size cities, because, as you know, in Canada, we have a lot of smaller cities that are doing their best, especially in terms of road safety and active transportation, but lack of people and manpower to do everything. So one of the purpose of this team is to help those people to make better decision.
Yeah, I'm happy to follow up, Marissa. In terms of like the skeleton framework development, there is kind of this fine line of having a product that is like too generalizable and then perhaps maybe too specific to the data we've gathered from specific sites. So one of the challenges for the framework development is to find a way to capture kind of these elements that are involved in the implementation process across all these different cities and sites, depending on the size, and then have some guidance as to how to tailor it according to the needs of the particular municipality and the folks working in those spaces, and the needs of the community members who are directly affected by the intervention itself. As I mentioned earlier, like equity being a really big piece of this work, having those folks, those community members involved in the process from the get-go and throughout in different ways is central to ensuring that any intervention or innovation really meets the needs of the particular population. So as we have our discussions like with our colleagues, and as we draw insights or glean insights from the data collected already, especially from objective 1, that is really much in the forefront of our minds, is trying to ensure that we kind of navigate this, I guess, kind of a tension between a generalizable product and one that is tailored specifically to a particular context. And that is, again, how we're going to try and address the scaling up and out challenge broadly.
Okay, perfect. Thank you to both of you. So we have another question here. It's, are you working with any jurisdictions to support the development and implementation of their sustainable transportation plans? Now, you had a list of all the different sites. So are you already involved connecting with those jurisdictions right now?
Oh yeah, definitely. We've been working with them from day one of this project, I would say. We even were able to have an in-person meeting last March in Vancouver with a lot of cities send one person. That was an amazing 2 days actually, where we listened to them and actually learn a lot on their daily life with that kind of interventions. We're not per se within specific plans for sure, but some of those interventions we will look at, they are part of plans, and maybe that's why we're having such it wasn't that hard to actually convince anybody to come in this project because they are interested in us studying what they're doing, but also to get better in the way they're doing things. This is the whole point of us gaining and them gaining. So no, we're not like following. Well, we will follow interventions through time, hopefully, just because we want to look at outcomes and implement. Like we have different not levels, but stage of implementation in those cities for specific projects. Like some of them are just at the plan and some of them are already implemented for a year or two, so this is how we can like not choose but see if there's any difference depending on the stage, but not specific plans per se, because in those plans there's way more than what we want to cover for capacity for sure.
Okay, great. And I have a question here from my research assistant, and she's wondering if you're looking at the impact of adverse weather conditions on implementing sustainable transportation methods, especially here in Canada with our 4 seasons, snow and so forth. So is that a factor that you're looking at?
Well, yes and no. It is part of the reflection when some cities choose their interventions. There's even another A. Is that another A? It's all age and ability and all condition, I think. I think there's another A. I don't know if there's anybody from Calgary in the room, but it's Tony Churchill who was talking about that because they want their network to be also for winter, for instance, So we didn't always available. Thank you, Karen. So there is a part of this and some of the reflection for those interventions. So we will definitely look at it in that kind of way. So it's more a seasonal one than a daily one, obviously. And we'll see how it goes. A lot of they call it also the white network sometimes for some of the bike infrastructure because they want it to be white in the winter, like I know in Montreal, that's what they call it. They have like the all network and then the white network. So this is something that's going to come into the discussion for sure.
Okay, and Emily, you had something to add?
Yes, so on that note, with regards to winter and maintenance, the scoping review that was conducted, a lot of the examples of sustainable transportation infrastructure were in regions that don't have winter. So a big gap in this literature are to tailor these kinds of interventions for a climate that varies. And in the examples that did kind of use examples in cities that do have all the weather, maintenance is a huge factor and a barrier just because of cost mainly. And as a result, you have less of the network being maintained for winter or maybe sections not at all. So again, how do we find a way to make that central for any sustainable transportation like intervention or framework that is meant to be, that will be built or designed and then implemented in a city that has all the seasons. So again, the capacity is aiming to really fill that gap.
Yeah, something that came up in my mind is if you've got this intervention and then the implementation is another part of it, like just for it to actually be carried out in the community, are you looking at the intervention itself and whether it's successful if carried out perfectly? And then the implementation is a separate thing because maybe the intervention part is fine. It's just you have to get at some of the core reasons why it's not getting. I don't know if you're separating those two out. Okay.
Yeah, definitely. That's why we were interested in having different stages of implementation too, in our examples. But we want to look at the process itself, but we also want to look at, okay, now that it's deployed, does it have any effect on actual speed, for instance, or on active transportation? This is a different part in how we're gonna unfold it as a team because data are not there as much, let's say. Collisions is fine, but data on active transportation are pretty scarce in cities. So that's why we're going to do the survey and the focus group. We're going to go gather those data by ourselves for some of it. We have like census that got some info, but we're missing a little bit of data here throughout time. And then for the implementation part, then this is why we're going to do interviews, so this is a bit different even in the process that we're going to study them, but we're definitely looking at both.
Okay, great. And Emily, you wanted to add something?
Yes, so this really kind of highlights the complexity of this work. And even from the perspective of developing a framework for implementation in terms of the existing literature, they are kind of categorized into like kind of process frameworks or determinant frameworks that look at like the, again, barriers and facilitators to the actual implementation, or evaluation frameworks. So ones that look at the intervention once it's been implemented and to determine its effectiveness. So that's another kind of layer of complexity that we are navigating as we develop this framework to ensure that it does kind of address all these needs. Again, depending on the particular municipality and the needs of the community, et cetera, or where they're at in the stage of implementing the particular intervention, to ensure that we have a product that can be adapted to the context and also kind of addresses all these key elements within implementation, like you brought up, Brenda. Like it's kind of a huge undertaking to look at just one part of that, let alone the fulsome process, including the evaluation onward. But in terms of, again, filling these gaps that the CapaCITY project aims to, it's really important to have that fulsome picture, which is why we have so many folks working on these different objectives in different areas.
Yeah, and I'm just wondering within each intervention, are you looking for common elements so that, because there's so much variety, I guess, across different cities, and some are big, some are small, and depending on, what the issues are there, like, are you hoping to kind of cherry pick, I guess, a little bit in terms of these are the important elements that are present in all these programs, so that you can draw a stronger case to be able to say, in I don't know, 5 of these where it is successful, these are the things that you have to have in place, basically. Is that kind of one of the goals that you're trying to achieve?
Yeah, that is definitely one of like the big starting points for this work, and to kind of have that as a deliverable. And then some of the more like detailed work would be how to assist municipalities in adapting that to their particular context, right? So the sustainable transitions literature I mentioned earlier on in the presentation, what's really great about that body of work is it sees the intervention as like kind of this innovation or operating in a space that is changing and has a relationship with the context around it, which may be in conflict with it, right? But the two kind of evolve together, and we have to take into account all those different kind of forces and factors in the context. So there's space for, I think, in every intervention climate, for example, there is a political context that has to be accounted for, and whether that be a facilitator or barrier to the process at design, implementation, or even in evaluation, right, can look differently. So I think the more kind of knowledge that we have as to like the different ways that can play out, which is why the data being gathered for objective 1 is so crucial for this work, is to really get the insight as to what's actually happening. We'll be better kind of armed to craft a product that will help not just the cities involved, but others that weren't included in this project, but are still looking to implement interventions for sustainable transportation.
Okay. And I think this, it may be along the same lines as the question I asked, but I'll just read it in case it's slightly different. Would interventions be analyzed together, for example, geometric change and speed cameras in the same project?
Yeah, this is one of the interesting, I was about to say unexpected, but well, the team has been working with cities for long enough to know that there's many spots where there's more than one intervention happening at the same time. But what we see more and more in a few of those cities, at least, is that it's major rebuilding projects, for instance. So it's a whole street, for instance, like a lot of, like many blocks where they narrow the lane, they put a 30-kilometer zone, they put a bike lane, there's a whole bunch of things happening at the same time. So it's going to be interesting. So it will be part of our analysis for sure. Both at the implementation side of it, like why did you decide to put everything there, for instance, but also at the effect on collision and on active transportation side. However, to disentangle what had which effect is a bit harder, but the combination, if the combination has an effect, that this is something we will be able to do, to say, for instance. So yeah, we'll definitely have a look at this, because it's more and more common, I would say, to just do projects where there's more than one intervention at the same time. So this is something that is interesting also.
Okay, well, that's wonderful. And I do want to give a few minutes to the president of ITE Canada to officially thank you for your presentation. And I just, yeah, it's an exciting project. It's on over 6 years, you said. So we look forward to some updates, hopefully. But good luck with it. It sounds like quite an undertaking, but very, very meaningful work. So, and I'll
Thank you. We'll come back in a few years to show you what happened.
Sounds great. Perfect. Okay, I'm going to pass it over to Ryan now.
All right, thank you very much, Brenda, and thank you very much, Dr. Cloutier and Dr. McCullough, for such an amazing presentation today. IT Canada is really excited to be part of this project as well, and really supporting the research across Canada, and exciting to see this information move forward. So on behalf of CARSP and IT Canada, thank you very much for coming out today and making this presentation to our memberships. Thank you very much to those who have come out today. This is a great opportunity for IT Canada and CARSP to leverage kind of the memberships of both organizations to really learn about some of this information that interests transportation professionals from across the country. So thank you very much. So with that, I will pass it back to Brenda to formally close our session.
Okay, thank you so much, Ryan. And I just want to remind everyone again that there is a post-webinar survey, and we really encourage you to complete it. It's there to provide feedback to our speakers, but also to give us some ideas on future joint webinars that we're going to be holding together. And they, of course, are free to our members. So with that, I wish everybody a great rest of the day. Take care.
Thanks, Brenda.
Thank you.